All right, I think we can go ahead and get going. I think everybody's had enough time to sprint between offices or meeting rooms or what have you. First off, I'd like to thank everybody for coming today. This is the first in the series of A Full Plate. My name is Robert Caphammer, president of Ad Cucina, and really looking forward to sharing a conversation with you guys today about a topic that our industry in the food service greatly needs to hear more about. So this is the first of a four-part series really designed to bring conversation, solution, and awareness to workplace mental health. If you guys want to flip to the next side, I think you'll hear from a couple of us today. You'll hear from myself, Robert Caphammer, but you'll also hear from Hassel Aviles, the executive director of Not 9 to 5, a global leader in mental health advocacy. And as we all kind of look through the past year and a half or so, and even in pre-COVID times, the genesis for this idea is really kind of born between passion and love, both from an Ad Cucina and Not 9 to 5 standpoint of the restaurant industry, of the food service industry itself, and the desire for us to help it in any way we can. Much of our experience, whether you work in the restaurant or around it in the supporting parts, it really centers around people. And I think that's a lot of what the conversation is going to be about today, is really level setting, the first part of the series into how we can help workplace mental health. We know that it's never been more important through the last year and a half or so. So before we get too far into it, I'd love to give you guys just an overview of what we'll cover off today. So you've kind of already heard the intros. You already know us as well as most. We'll cover off on a little bit of industry research. We'll take us through both pre and post COVID kind of current state. We know this was an issue prior, but it was even more in kind of the limelight ever since of COVID. We'll talk about some tools and some resources that you guys can have access to. And then we'll save some time at the end for Q&A. I'd ask that throughout this process, you can just drop them in the chat, any questions you might have. I'll do my best to pull them out at the end from a moderating standpoint. We'll make sure we get most everything answered we can. I think that's the bookkeeping side of things. So with that, I will turn it over to Hassel and really cover off on the interesting stuff. So thanks so much for joining us, and Hassel, take it away.
Thank you, Robert. I really appreciate that. So as Robert mentioned, my name is Hassel Aviles, and I grew up in the restaurant industry. I have worked in it since I was a teenager. I have a complicated love-hate relationship with restaurants and the dynamic which happens in the workplace. And one of my biggest passions is now really, exposing and sharing information, education, and research and data around workplace mental health in restaurants. For those that don't know who Not 9 to 5 is, we are a nonprofit global leader in mental health advocacy for the food service sector. We do this through practical education and community building, and we are reimagining the hospitality and restaurant industry by breaking stigmas and fueling hope. For too long, we've focused on the sustainability and ethical treatment of products and ingredients. And, here as someone who has worked in restaurants for half my life, over 2 decades, I have so much front of house experience all the way up until owning my own restaurant. And I really saw a real desperate need for more conversations, resources, and support for workplace mental health. Just to put it into context, I just want to start with why and how restaurants can do this. I think oftentimes, what I hear from restaurant owners and managers are a lot of not pushback, but a lot of kind of confusion around like, well, I'm not a counselor, I'm not a therapist, like how can I help my staff, what am I supposed to do? And I always like to contextualize it a little bit in saying that if I was in the kitchen and I sliced my hand, you don't need to be my doctor to stitch me up. I just need you to help get me to the help I need. And it's the same thing with if I have a mental health crisis. You don't need to be my therapist or fix me. You just need to help get me to the support I need. So I really like that analogy and that context because it really helps to explain how we can all help ourselves and each other. So before I jump into the presentation, I do want to give just a short content warning. This presentation will touch on difficult topics such as depression, anxiety, suicide, and other mental health and substance use challenges. So if you need to excuse yourself, that's completely fine. This is being recorded and you can watch it at a better time. So what have we heard? What we hear a lot about in the restaurant industry pre-pandemic and still today is the labor shortage. It was an all-time high pre-pandemic at 75%, and it continues. The staffing crisis continues. The cost of turnover, which for anyone that's listening doesn't know, is approximately $6,000. So if you have a team of 100, let's break that down a little bit. If you have a team of 100 people at the start of the year, by the end of the year, you have 75 employees who will be gone. And by the year's end, the cost of replacing those hourly employees averages, $6,000, which in total the cost is, close to $500,000, $450,000. So, there's a real business case, here for workplace mental health. I think oftentimes people think of it as like an emotional, or a nice thing to do, but there's a real business case for taking care of your staff and team and creating that kind of culture. So we know that losing employees costs you money, but is this a small problem? Like, how many people actually have mental health and substance use challenges? Not 9 to 5 put out our first survey in 2019, and this industry-specific data showed us that 90% of people say yes when asked if they live and work with mental health and substance use challenges. So, results like this data point indicate that our industry had a mental health epidemic long before the pandemic. And so, similar to what I said earlier in terms of the comparison between physical health and mental health, we all accept in our kitchens that we have a fire extinguisher, that we have first aid in kitchens, in restaurants, behind the bar. And, we do that because we know that someday that might save a life. The same can be said for mental health and substance use challenges. So, there can be resource lists built, there can be training put into place. And we really wanted to know specifically how can we support restaurants. So we put out a survey in 2019 and we really wanted to figure out what are the main pain points that people are experiencing. We know it's a problem, we know it's a big problem. What specifically are we talking about? So these were the primary concerns that came up in our data. And, I think this research really validated a lot of our experiences. And to take you through it in more detail, the specific primary concerns, the number 1 and 2 are always depression and anxiety. And that's the same case whether you're speaking to industry, in the workforce, or we've also surveyed many culinary and hospitality schools, and we see the same thing. Number 1 and 2 are always depression and anxiety. When we say substance use, we do include both alcohol and drug use. And as you can see, the numbers are fairly high. And work addiction in our industry is like a common term, but really the medical condition it speaks to is burnout. And then you'll see there's a tie between drug use and disordered eating. So how does this affect work? So if we know that these are the challenges, we know that these are the primary concerns, how does this specifically, affect people in the workplace? Well, stigma is extraordinarily high, as you can see. You can see that, 81% of people say they keep it to themselves, and a lot of that is that stigma. But I really want to highlight the absenteeism that you see in 27% of people calling in sick. What that shows is, people not feeling comfortable enough to really address what's going on, and instead they quote unquote call in sick. And in terms of turnover, which we again hear about in restaurants all the time, that's 1 in 5 people that will quit their job and leave because they do not feel that they can address their mental health and substance use challenges. And that small 2%, are given paid sick leave. But as you can see, there's a real disparity between physical health and mental health in the industry. Then we got really curious. We wanted to know, do people actually speak openly about this at work? When you work in a restaurant, you work in a bar, are you talking about this? And again, stigma being extraordinarily high in this industry. there's not a lot of workplace mental health discussions happening. And, HR is seldom trusted. But I do want to also point out that, to be honest, many restaurants and bars, HR is not at all a department, let alone or there's not a person, let alone a department. So, that really speaks to that 0% you see. And then we got really curious about well, why aren't you speaking about your mental health in your workplace? What's going on? What are the specific reasons why? And you can see that there's a lot of stigma and shame still in this industry around these open discussions of mental health and substance use. So I think I wanted to highlight as well that the 41% of feeling well, people wouldn't understand. I think that also really speaks to the lack of education, acceptance, and trust and support that we're not seeing in the workplace currently. So what about now? That was pre-pandemic, fine. But as Robert said earlier, without a doubt, COVID has made these problems worse. The amazing thing that has happened during this time is that this conversation has gotten much more popular and much more widely accepted. Employers and employees are both becoming much more comfortable with addressing this topic. And I think, Not 9 to 5 has seen it in terms of exponential growth. But this issue was there before. And in terms of workplace mental health, food and beverage, unfortunately, comes in as the top 3 for worst workplaces in mental health, following manufacturing and retail. And what I find interesting about that is that so many of the companies that are in food and beverage or in hospitality, including breweries, distilleries, wineries, or other consumer product good businesses, they also have manufacturing and retail as part of their business. So, overall, mental health in our industry is not a COVID problem. It's a persistent endemic problem that COVID has made worse. And during this pandemic, sad to report that there's also been obviously a huge increase in stress. There's been a huge increase in suicidal ideation, and specifically to youth, which, so much of our industry is made up of. And how have restaurant sales been impacted? Obviously, we took a great hit right before COVID-19. And, there's a poll that just went up, so I hope you'll all fill it out. Do you think the awareness of mental health challenges will support the restaurant recovery? I'd love to hear what you think on that. And I think that, by restaurant type here, we clicked FSR and QSR, but you can definitely see the huge ride that we've been on this year. And obviously that impacts everyone's mental health. So no one is unaffected by what's happened in our industry, what's happening to our industry currently. Obviously it shows up in different parts of North America. But I really want to dive into and explore the different points of view that people are experiencing within the company. So there was some data that just came out recently this year. And if there's restaurant owners, CEOs, or C-suite executives in the audience, you'll appreciate the next couple slides. This data is current. It was broken up between different segments, different industries, one of them obviously being restaurants and hospitality. And, there's a lot of disparity in terms of perception. And I think fundamentally executives and employees agree that mental health is an important issue that employees should support. However, there's a significant gap between the CEO and the employee perception of the available mental health benefits. So, many of us, I think, as leaders, think of ourselves as very accepting of these issues. And yet, some of our teammates or some of the people that work for us or with us, don't feel that support. So I really appreciated this data point because it really started to show how different people have different perspectives on this topic. So to continue with this study that was done this year, this disparity between how CEOs are coming to believe that companies are doing enough to support mental health. There's a big difference when you look at 98% of CEOs saying they offer benefits for employee mental health, yet only 55% of employees agree. I think that that obviously there's many reasons why that can exist. And I just wanted to highlight that sometimes it's not just that they're not offered. Oftentimes what happens is some restaurants or large hospitality groups actually do offer employee benefits, but there's not enough open communication about how to register, how to sign up, or even using it. So certain industry leaders may be offering these services or might be offering certain programming, but there's not enough open communication, and there isn't like a norm to actually tap into these services. The good news is that everyone agrees, CEOs, employees, everyone agrees that mental health support helps you at work. So I think that to me was a really kind of good news data point. And, during the pandemic, all of us, I think, have felt, certain changes and fluctuations within our mental health. And I think what really needs to start happening now is more conversation, communication, and, what do we do specifically in the workplace? And I just wanted to define, when I say mental health support and what the study, when it asked specifically mental health support, the way they defined it in the study included a wide spectrum of activities, from mindfulness practices to coaching to formal mental health services with a therapist or a psychiatrist. It can also include access to an EAP. So if anyone doesn't know, EAP is an employee assistance program, and that puts you in direct access with professionals. So what can we do? We now have established that there's been a problem for a long time. We've established that it's gotten worse due to COVID. And so where do you start? You're an owner, operator, you're a manager, you're a restaurant executive. Where do you start? And there's really 3 high level points. And this was validated from the study that I just showed you, but this is also validated in the work that Not 9 to 5 does, is, we know there's a direct link between employee retention and improving workplace mental health. So where do you start? What do you do? Number 1 is you must invest. So some places invest financially, other places invest in different ways. It depends the size of your restaurant. Obviously, it depends what situation you're in, but regardless, there needs to be an investment of either financial, time, and effort. Research shows that employees appreciate and now are starting to demand and expect a mental health benefit as part of their compensation package. So whether that includes traditional solutions such as EAPs, which I spoke to earlier, employee assistance programs, those are the ones that allow access to mental health professionals, or, some companies offer what is now a norm, virtual access to virtual mental health care. So I think, these all work towards improving mental health outcomes, which help attract and retain talent. Number 2 is communication. I think so often we do not communicate enough about our own mental health, and let alone, have direct conversations with the mental health of our team. And so it's really, that lack of awareness that really sometimes prevents people from seeking and accepting help. So I think if you've done the work to already find a mental health benefit, make sure employees know about the benefit, communicate, build strong communication plans to connect people to those services, and make sure that those services connect to employees' everyday needs. A little data point to share on EAPs is I have spoken to many different types. There's so many all over North America. Different insurance companies offer different EAPs. Usually industry-wide usage standard is about 10 or 11%. However, when you speak to restaurants, when I've spoken to restaurants, large hospitality groups, large corporate restaurant groups, the usage is usually around 3 to 4%. So it's a huge difference between other industries and restaurant specific. So that's why I think it's so important that we really zone in on restaurant specific data. And that speaks to the last point, which is to develop that culture that normalizes, these conversations and supports the investment and communication plan that you have for your team. The other last point is to really highlight that communication piece that employees really appreciate when leaders speak about mental health. So really help normalize that by, if you're an industry leader, if you're an owner operator, by really like growing that conversation and sharing. It doesn't even have to be sharing personal details. That's not what I'm speaking to, but just normalizing even that, you know, my mental health is in a really good place, or I'm struggling with my mental health. It doesn't have to be specific, or you can speak to different things that you do that help. So all of this data, you know, and all of these learnings led Not 9 to 5 to build, you know, the world's first digital mental health education platform designed for our industry. We named it Connecting, which Connect stands for Change Needs Everyone Coming Together. We really feel that it's something that the whole entire industry needs to be a part of the solution. We've all been a part of the problem. So we all need to work towards becoming part of the solution. And the first course that we built through Connecting was called Primary Concerns. You know, this course is something that took industry industry professionals, mental health professionals, and decades of lived experience to put together. It was, you know, really designed to help anyone identify, understand, and respond to crisis situations. It was really influenced and inspired by mental health first aid, which, if anyone doesn't know what that is, it's a program very similar to regular first aid. You know, it's a CPR kind of first aid, and it's just made specifically for mental health. Really, what it teaches you is how to hold space and how to develop your support skills. So what we did is we took our influence and our inspiration for mental health first aid, we mixed it with our research and data, we built a team of professionals to help us put this all together, and we came up with this course. And so far, the response has been overwhelmingly positive. It's been shared all over North America. It's actually even been shipped to the UK. We've built some partnerships in the UK. And, you know, we've heard from so many different levels. So when we put it out, we put a beta version out late last year. It was shared with anywhere from a dishwasher all the way up to owner operators to, you know, large corporate executives in the restaurant space, and different walks of life, different, you know, roles, and everyone really came back with only positive. Obviously, there was some constructive criticism, which we have now put into the new version, which is launching at the end of the month. So this new version will be, you know, even bigger and better than the last one. This last testimonial is one of my favorites because it really shows, you know, and speaks to the normalization of just basic education of workplace mental health and just any general mental health, which is that any experience that you have with your mental health or substance use challenges are really just a natural reaction to abnormal events. You know, all of us have mental health. Everyone has mental health. If you're human, you have mental health. And it lives on a spectrum. You know, it ranges. It depends where on the spectrum you can fall. But I really like this idea of normalizing it more because it makes it easier for, again, like I said earlier, it makes it easier for people to seek and accept help. So I just want to highlight, as we come near the end of the presentation, I really want to highlight the business case for workplace mental health. And I really want to speak to psychological safety. So as I said earlier, for so long, we are so, you know, quick to accept that we need to put in practices and support plans for physical health, you know, for food safety, for physical safety, and we've really, really neglected mental health and psychological safety. And, you know, for anyone that works in this industry, you might be listening to me and thinking, what is psychological safety? I don't even know what that means. And, you know, that's kind of sad that people in our industry, for the most part, I didn't even know what psychological safety was until a few years ago. But once I came to learn and understand the term, it really dawned on me as to, like, it explains so much as to why we found ourselves where we are. And the biggest thing is, okay, in simple everyday language, psychological safety just means you're in an environment where people feel that it's safe to take risks, make mistakes, and be vulnerable with each other without any negative consequence to how they're perceived or their job. So What does that mean specifically? It means, we need to learn how to give and receive feedback in restaurants without feeling like our job's at stake. We need to learn how to be vulnerable with one another, so that when situations come up, it's already normalized. We need to acknowledge that, lower level employees can take risks and we not penalize them for it. And if we can practice this in small ways, it's like a muscle, right? It's like a weak muscle right now, but if you can practice it over time, you strengthen it and you get much, more accustomed and comfortable, providing that psychological safety in the workplace. And in kitchens, oftentimes that's really tricky. And in restaurants in general, that's really tricky because our industry is so heavily influenced by the brigade system, which runs on a hierarchy and chain of command, where everything only comes downwards. And I think it's really important to question that. I think it's really important to explore, how we could flatten that a little bit and allow for input to come from all levels of the company. So to speak to, workplace mental health and the business case for it, there's some points here that highlight that what increases and what, decreases and what gets reduced. The big one around labor shortage is, that real reduction of turnover and its respective costs. But my favorite stat is the ROI of workplace mental health. The World Health Organization put together a study a number of years ago, that for every dollar invested in mental health care, there's an estimated return of $4 in improved health and productivity. That was really exciting to read that study and to learn more about how there is such a strong business case for investing in workplace mental health and building this out for the team. And last year, there was another really cool study put out by Deloitte. It was a Canadian study, and it did focus on the ROI for Canadian firms. And it did show as well an annual ROI. So annual was lower, it was about $1.80 for every dollar invested, but after 3 years jumped over $2. And over time, it keeps getting higher and higher. So it's a long game play. It's not an immediate, obviously, return. The immediate return or benefit that you'll see, though, is the attracting of new talent. And I know that hiring right now is something I hear all owner operators and chefs complain about. So I think, again, that speaks to the business case here. But one really cool thing about the Deloitte study was that Deloitte was so blown away by their own research and what the data showed that they increased what they were spending, which was $300 per person on workplace mental health services, to $4,000 per person annually. So I think it was really cool to see that the company that did the research really started to walk, the walk and not just talk the talk. So I want to end off with, what is the most important skill that you can develop that helps in the workplace and doesn't cost you anything? So as an owner operator, what can you do that won't cost you money, that won't, mean that you have to start a whole new program, that won't require a ton of investment. And this is something that we can do and practice. This is a skill. So also this is a skill that helps not just in workplace mental health or in mental health support skills, but this is a skill that helps in so many different ways in terms of workplace. And that is active listening. And if someone's like, okay, what's the difference between listening and active listening? I'm listening to this presentation, and what's the big difference? I really want to highlight that active listening is listening to understand, not to respond. So I think it's really, really important to pay attention to that and pay attention to people when they're, especially if they're coming to you in the workplace with something that might be wrong. Like I spoke to earlier with psychological safety, if someone's trying to be vulnerable with you, if someone's just shared that they made a mistake with you, if someone's talking to you about a risk they might want to take, something new they might want to try, this is when active listening really needs to be kicked into high gear. And anyone can learn how to develop this skill set, listening with your body and your mind. So oftentimes there's so much going on in our heads as someone's speaking right now. I'm speaking this whole time, and I'm sure you have all kinds of other things going through your mind. And I think that the big thing there is really trying to listen, to understand to what someone is sharing. Obviously, don't look at your phone when people are talking to you is a big one. And, just really paraphrasing or prompting questions back to really show that person that you are listening and that you want to know more. Sometimes paraphrasing will also create more space for the person to share more. So oftentimes, if you just repeat back to someone what they just shared with you, it can really help you develop a more meaningful conversation. And that takes me to the end of our presentation. I really want to thank everyone so much for tuning in and listening. We have a lot of questions that we would love to hear from you. I think there was some conversation even shared in the chat. So I'm going to stop presenting. And we're going to do one more poll to see if after that presentation, do you feel that you have more awareness on the topic of workplace mental health in restaurants now?
So while they finish out that survey, I did, prep a couple questions for you. I wanted to keep you on your toes. So I thought, knowing the cross section of people that join this call and whether it's a QSR owner operator or employee versus a FSR or casual dine, the food service sector is a wide industry. How do you see this kind of mental health awareness problem or the challenges we're facing now affect those industries differently? Working in a fast food joint is much different than a full service kitchen and line cook scenario. So would love to hear your perspective on how that might impact the parts differently.
Yeah, thanks, Robert. I think that's a great question. You're right. I mean, all of those environments are different. The QSR, you have that real intense, high stress, fast paced. Really high stress, fast paced is everywhere in our industry. And in fine dining, you have that less forgiving environment, and that really push for perfectionism on a plate and in service. But the thing is that truly all of them require high intense, very demanding physical and emotional labor. And I think, that's something to really point out and highlight, because when you have that nonstop environment where, oftentimes people aren't even taking legal breaks, let alone regular breaks. And I think it's really important to, look at the difference in the environments. But I also want to point out that I think what's really important to highlight is that anywhere there's restaurants, any kind of restaurant, QSR, FSR, whatever type of restaurant they are, anywhere that there's restaurants, anywhere that there's humans, you're going to find these issues. Workplace mental health, as you saw in the presentation, those stats and that data is from all different kinds of environments and was from all over North America. And we have a new survey out right now, which all of you will get in the post-event thank you email. So if you could take a few minutes to fill that survey out for us, if you work in the industry, or if you could share it with others that work in the industry. That survey was put together with the help of Reunion, where I work. And, it will, I'm sure that the data once again will show that regardless of the size of your restaurant, regardless of the style of restaurant that it is, that we will see the same results come in. Because like I said earlier, all of our data, even before, was from different types of work environments, as well as even culinary and hospitality schools. So yeah, I think that it's a great question, though, and thank you, Robert, for that question. I also saw a really great comment. I don't know if you read it, Robert, that came in from Lisa, a certain program that they had started. And it's funny how she speaks to here how people had each other's backs. And that really reminds me, there's a program in California called I Got Your Back. It's actually named just that. And I just want to share really quickly, a really cool program that they do is when people are coming in and they're checking in and they're, clocking into their shift, they are asked to put into a certain box a specific color of depending on how they feel. And this I Got Your Back program is so cool because basically what happened is they found that it had a huge impact on the entire team. So when you clock in and you're starting your shift, you either put in red, yellow, or green. And so green is like, I'm feeling great. Yellow is like, not so much. I'm kind of struggling. And red is like, Mayday, I'm super fragile. I don't feel okay. And so at lineup, when you first start your shift, you get your whole team together and you ask, you pull out the box. And after you do the specials and all that kind of stuff, you look and you can see how the team is feeling. So you get to tell your team right away, okay, you know what? Everyone's feeling green today. Let's go have a great service. Away you go. Or there's 4 of us here that are feeling red. So let's be extra compassionate with each other. Let's be extra supportive, and so anyways, I just thought that this program was so cool and really starting to change the restaurant dynamic in Sacramento, California.
Yeah, that's awesome. And I think it's another good point tying back to like just having the conversation on the front end. I think to tie into the question that I asked, I think with labor shortage and the stress that we've asked on all employees, whether it's casual dine or QSR, is you have to essentially take care of what you have now, right? I think that is the from an operator standpoint most prized possession, and then you have to actively get better as well. So I think making sure you take care of what you got, and then making sure you're planning for the future, I think is a nice scenario too, because I would wager to bet there's a lot of people that would be red right now. We've asked less people to do more work for the last year and a half than ever before. So there's definitely some stress on the traditional models, and bringing this kind of awareness certainly help. I've got one also kind of pop culture topic, or definitely kind of in all the conversations, is every other person is talking about wages and how they can be competitive in the space. Obviously, money is only one factor in an overall employee's well-being. But how do you see the wage conversation influencing mental health, if at all, in the future? As that's whether it's the state or federal conversation, I think it's in just about everybody's mind right now.
Yeah, I agree. I think it is definitely on everybody's mind. I really appreciate that question. And wages has a huge impact on people's mental health. There's tons of research and data that goes to show the connection between financial health and mental health. But it's a tricky topic, it's a really tricky topic because it can potentially seep into tips. And, that is often problematic for certain people. A big thing that we've seen in restaurants this year, thanks to COVID, is, you just kind of highlighted it, is that people have had so much more to have had to take on so much more in their roles. And in terms of, like you said, taking care of who you already have and taking care of your team, I think this also speaks to attracting new talent as well. So you want to keep, your talent, and then also as you grow, you want to attract new talent. And absolutely, wages competitive wages is a huge thing. Now, whether that includes tips or whether you don't include tips in that, that depends on what kind of restaurant you run. But one thing I want to highlight, the direct connection between finance, your finances and your mental health, is the security. I think one thing that people don't realize, if you've never worked in restaurants or if you've never worked as an hourly employee and relied on tips, is that there's always this really high unknown of how much money you're going to make. how much am I going to make next week? How much am I going to make next month? How much am I going to make, next, whatever the next season is? And that lack of security and that real difficulty for people where they can't plan properly, and it makes it really difficult for savings as well. That becomes really, really complicated. And so in this last year, since the pandemic started, I mean, listen, these issues existed pre-pandemic, but in the last year, what we've seen in this industry is a real intolerance for the way it's been for a long time. And so, like I spoke earlier on one of the slides, there's now a demand for competitive wages. There's now a demand for workplace mental health benefits, and that's going to continue to grow. That's definitely going to continue to grow. And, there's no real answer, because like I said, every restaurant's different, every restaurant's different size, different style. But it is extremely important to start to think about wages as you're trying to maintain and retain your team.
Awesome.
If anyone else has questions too, please feel free to throw them in the chat so we can answer them for you.
I think one piece that I'll give a brief overview on as well, everybody thinks of their questions, is the next topic will be the end of June, the 24th, I believe. And, Hassel had teed it up a little bit earlier. The idea of psychological safety will be the focus, going in a little bit deeper on that in terms of research and how you guys can approach that with active employees and with and outside of your organization. I think from there, we'll also look to have a special guest speaker as well. So that will come out, the topic and an overview as part of the follow-up email from this. You'll get a copy of the recorded presentation, and happy to follow up and answer any other questions as well. But we've already got some exciting new topics that really can be used to help influence your business. So that's that. And then we did get one question. So do you believe that there will be a significant increase in menu pricing after COVID?
Do you have a thought on that, Robert? I do. I would love to answer that.
Sure. Yeah. I think yes is the short answer. I think it's happening already. I think a lot of some of this stuff does come with some cost, and that has to be accounted for somewhere. I think simplification and ops efficiency is a priority across restaurants. So hopefully it's not as high as it might have been once upon a time, but definitely coming out of COVID, if we haven't already seen it already, just sheer on commodity pricing before we even get to the more operational side of things. But yeah, definitely would expect some if we haven't already seen it.
I want to say how much I love this question. I think it's so important to talk about how much culinary experiences actually cost. I think for so long we have avoided that question. And I say culinary experiences because it's not what food costs. Because when you go to eat, you're not paying for just the food, right? You're paying for the labor, you're paying for the food, obviously, but you're paying for fixed costs, infrastructure, all these different things. And it's all hidden in the price of a burger. And so one article that came out recently by Eater was based on a series actually that used to exist a couple years ago as well. But basically what this writer does is he takes the price of a dish and he showcases it as all the different costs of the dish. And it's amazing because it really starts to show you. So the author is Corey Mintz, and the article is in Eater. So if you want to Google it, I highly recommend it. And the recent one that he did was on a restaurant in New York City called Dirt Candy, which is owned by Amanda Cohen. And the dish he focused on was the croque monsieur. And this dish costs $14. And when, this dish is eaten at the restaurant or ordered for takeout, they actually experience a loss of between 80 cents to $3. So there's actually no profit in terms of the price of the dish. When it is through a third-party delivery, it makes a $2 profit. But a big thing to highlight for Dirt Candy is that, she does not use the traditional compensation model that most restaurants use. Her model is including a wage subsidized by tips. It's a tip-free business, so they don't subsidize with tips. Dirt Candy's a tip-free business. The higher pay makes labor cost 50%. So most restaurants do not have a labor cost of 50%. And so I think, this article and Dirt Candy as an example is, oh, thank you so much, Gertrude, she put the article in the chat. I think this really goes to speak to, yes, there will be menu increases, and yes, there will be resistance to that and pushback, but I do believe that there will be more education around what it actually costs to eat out. There was another add to that. Do you think there could be an end to traditional tipping if it was embedded in menu pricing? Ooh, controversial question. One thing I want to share is the only time I've ever received hate mail was when I did a podcast interview and I said that I believe we need to move in the direction of abolishing tipping. Tipping is a very controversial topic. People feel that it's something very close to their heart, especially if you obviously are compensated that way. It can feel like a threat for certain owners. It can also feel like a threat because it also can make certain restaurant operators feel like, well, where am I supposed to get this like extra money from? The answer is menu pricing. And so I think that we are going to be moving to abolish traditional tipping. It is not going to happen in a week or a month, right? I think these things take time. Change takes time. Consumers will always resist and push back. But I do think it's really important because I don't know if all of you know, but tipping has a very problematic history. It's a legacy of slavery. It was started in a time when owners and business owners didn't want to pay full compensation for labor. So I do think we're moving in that direction. I do think it's going to take time. I do think businesses like Dirt Candy are a great example of the fact that it is possible. But I do think that it will require an increase in menus and the cost of culinary experiences as a whole. So that's an interesting question too. Would customers tip more if they knew it was going to support a specific cause, for example, mental health for restaurant workers? There are some restaurants that have done this. I know of one in LA where as part of the bill, they would add a certain percentage, and there was some pushback from some people. They wanted to opt out. They did not want to contribute to that, which, is interesting. But I think it's still, the problem with tipping is that you're leaving it up to the consumer versus just having an employer pay full compensation for labor. So to me, I think that's the biggest problem. And I agree with, the last comment here, JZM, the public doesn't know or understand that servers are only paid $2 an hour. As a former server, when you do add up all of your hours and when you do add up what you finally walk away with, it obviously depends where you work. It's usually not what it says on paper. And that's the problem, right? And then with tipping being something that is now decreased. So due to the pandemic, we've seen a major, massive decrease in tips. Most or hourly employees that are also compensated with tips have seen a reduction of up to 75%. So when you're trying to pay rent and when you're trying to pay your bills and just eat and keep things going, keep the lights on, it's really hard when you used to have a certain amount of tips and now it's been decreased from anywhere between 60 to 75%. So, I think definitely as uncomfortable as change is and as long as change takes, we're definitely going to be moving in that direction. So yeah, thank you for all those amazing questions and really great comments. And I also wanted to shout out what Robert said earlier. Our next event is going to be on June 24th at 3 p.m. We have a really exciting guest. She is an industry veteran. Her name is Laura Green, and she's also a working therapist. She's a licensed professional counselor, lives in Chicago, and she's also the founder of an organization called Healthy Poor. and they do a lot of consulting in the space. And I love Laura Green so much, and I love people like her. There's not a lot of them, but specific experience and education and knowledge on both the industry and mental health, I think is so unique and so important to really unpack this like very complex topic. So yes, definitely when you get the thank you post-event email, make sure you register for our next event. It will be mostly focused on psychological safety, what it is, why is it important in restaurants, how do you foster it in the workplace, and I really hope that all of you will join us.
All right, that should conclude us here. I thank you everybody that joined us again, and hope to see you next month. And thanks again for the questions, and we'll see you next time.
And you get 6 minutes back. Enjoy your day, everyone. Thank you so much.